Dr. Kourakin, you dentists, obviously, you have your hands in everything, in cosmetic, almost cosmetic surgery kind of things, when you put dentures in it, implants, when you by not making teeth getting lost or putting implants in it, you prevent the bones from shrinking and thus person having this dried out tomato caved in thing. However, lately I keep hearing that you're literally doing work which has been done by dermatologists and by plastic surgeon, which is Botox and fillers. Tell us about that. What does that have to do with dentistry?
Well, Helmut, if the smile is a picture, we want to frame that picture. And we frame the picture with the lips, we frame the picture with the face, and what can we do to enhance the appearance of the picture of the teeth, the beautiful smile? Well, I'm very proud to say that I was one of the first of 13 dentists in the state of New Jersey to receive board certification in Botox and dermal filler injections. I do belong to the American Academy of Facial Cosmetics. And through our organization, I have learned various sophisticated techniques of injections. We will do lip fillers there, the Botox for the wrinkles in the face. These are art forms, and nothing gives me more pleasure. It's a passion that I sense that when we can create a gorgeous look, not just the teeth, but a youthanizing appearance of the lips, a more youthful appearance of the cheeks, the chin, the areas surrounding the mouth there that will enhance the entire face there. Now we put together a total product. Now we put together a beautiful face, a Venus, if you would. And that really, I think, epitomizes dentistry, because in the cosmetic world there, the eyes are important for color, the teeth are critical for color there. So let's frame the rest of it there. And because we as dentists, for instance, give injections. In my lifetime, I probably have given 250,000 injections. Who better is suited at giving injections into a face than a dentist? Myself. As I said, 250,000 injections to the mouth here. I know how to give an injection, and we give excellent injections. Plus the fact that we administer nitrous oxide. A dermatologist or a plastic surgeon is not going to administer nitrous oxide in their office. They don't have the facility, they don't have the equipment, they probably don't even have the training. So here, a painful procedure such as a dermal filler there can be done totally painless in our office there, because we can administer nitrous oxide. Plus we have the numbing techniques.
Did you just break up, doctor?
The patient, so they do not have to experience any pain from the injections for the fillers. We now have topical creams that we place on the skin, so that even Botox injections don't have to be felt there. Botox injections with nitrous oxides do not have to be felt there. So we can take the fear out of any kind of a cosmetic procedure there. Some women are just concerned that it's going to hurt too much there. They don't have to worry about that. We can address those issues. Some women are concerned and have a little bit of anxiety over it there, the fear of having the procedure done. We pre-medicate them with Valium to take that edge off. And the beauty of it is that once everything is complete, literally before they leave the office, they'll see the result. And that's a wonderful thing to see, the expression of happiness in a person when we've done a facial cosmetic.
Right. Well, Dr. Kourakin, that's definitely wonderful, all those reasons why actually a dentist is highly qualified to do Botox. I get that. I didn't think of it. Now, there seems to be one reason missing to me, and that is you dentists are literally the people who, make a face good looking, $1 million smile. You know how to adjust the proportion and the lengths and the color and everything about the teeth, the mouth, the cheeks in order to make that smile gorgeous, because dentistry has everything to do with artistry rather than just clinical expertise. So wouldn't that be another good reason why you probably know really how much Botox to put and where in order to make the face just perfectly arranged?
Absolutely, Helmut. $1 million face, $1 million lips. sometimes is enough. And yes, we want to study the proportions, and we study our patients very carefully. I do diagnostic photos of all my patients before we begin any procedure, and we map out the face. We look, some people have faces that are square, some people have faces that taper, some people have round faces, some people have oval faces there. So we know that going into the procedure, what is going to therefore be the best way to accentuate certain features. We can have individuals that are Asian people, for instance, there. We can do things that will make them look less Asian. That's actually a desirable trait for many Asian people. Some Asian people just simply want to accent certain features in themselves, their cheekbones, for instance. And once again, it's just about proportion. For instance, the lower lip should be 2/3, the upper lip should be 1/3. And many people don't understand that proportion. And so many times we see patients that come into us that the lips are literally a 1-to-1 ratio. It doesn't look right. Or the upper lip is too large and the lower lip is too small. Once again, it's just not cosmetically pleasing.
Right. Well, while probably cosmetic surgeons are well trained in that type of stuff as well, the fact is, that you go just one layer deeper, because you include the teeth. You might even say, look, if we do this, a slightly longer teeth might be good, or this. So anyway, you're naturally well trained on it. Well, absolutely phenomenal. I mean, really, you dentists, for all purpose stop at nothing, and that's good. That's a good thing. You really, you give holistic medicine or holistic dentistry really is what it means. You really include the whole body. There's no doubt about, from headaches to neck pain and shoulder pain to looking good to the Botox and keeping the heart, the brain, the liver, the kidney alive. It's absolutely phenomenal. It's phenomenal. As they say, love goes through the mouth. I guess lots of other things go through the mouth too.
Absolutely. With all the training that we receive in head and neck anatomy there, it's a shame for us not to utilize our talents, not to utilize what we've been taught in the dental universities there, to be able to help the entire body and to encompass what we now know in terms of both holistic treatments and mainstream medicine. It's a shame that would be wasted, and I'm going to take every advantage of all these different forms of treatments there and incorporate them into my practice.
Right, because obviously we patients, instinctively, we actually go to a doctor and say, Doc, what can you do for us? It's not, we know that a doctor is not a sandwich shop where you say, I want tomatoes, I don't want, I want mayonnaise, I don't. A doctor is like, Doc, what can you do for me? And if a doctor excludes a certain thing only because he isn't asked, he would do his patients a disfavor, wouldn't he?
Absolutely. Quite often I sometimes feel like a bartender. There are people come up to me and they'll ask me questions, psychological questions, questions about stress, questions about brushing their teeth, questions about, for instance, including in their will the gold crowns that they have there. Should they be included in the will? So, heart issues there, questions about the hips, the knees. There isn't a subject that we don't touch upon, it seems.
And you know what? That's just absolutely wonderful. It shows the confidence people have, maybe partially in dentistry and probably greatly in you. Dr. Kourakin, pleasure talking to you.
My pleasure, Helmut.